Hello and welcome to today's edition of the Annie G Pet Show with myself, Annie G, and I have, you wanted to be called now Brian P.
Annie G and Brian P. I just like it. It's got a meter to it, you see?
But people may think you're doing something, the P bit. Are we allowed to do that on the radio?
Well, I've never peed on the radio in my life, so it's always a first time, right? Hey, Brian, go for it, dude.
We are here to hopefully educate in an entertaining manner, which, by the way...
Well, I would say the preceding would fall under the entertaining at best, because it certainly didn't educate.
That was actually the premise at the beginning of BBC Radio. Did you know that?
I did not.
That was, I can't remember who, it was a Sir somebody.
Sir.
That was
Sir
their
Lancelot.
kind of mission statement. So
Okay.
it's ours as well. Not that I'm a big fan of the BBC right now, but we won't go into that.
Okay. You a big fan of Lancelot, though? C'est moi, I must humbly reply.
All I can say is I
moi,
know a very
moi,
bad
which is
joke,
I.
which I will tell you off the air about Sir Lancelot.
Oh, tell us on the air, for God's sakes.
no.
Now you got everybody provoked.
No, we would be...
You provocateur.
It's a British sense of humour.
Oh, okay.
Which tends to be more risque, as you know.
I like
So, it is that time of year when we all, well, I say all, but you probably don't, and actually I don't really, Brian, eat too much.
Oh, I definitely don't.
Are the wrong things.
Nope.
And our pets are no exception. So I thought, well, let's get an expert, I was going to say on the job, but that might be misinterpreted as well. So, without more ado, we are going to go to Dr. Ed Moser, who is going to talk to us about what we should or should not do with our pets over the holiday season. So let us first of all say welcome, Brian. Well, not welcome, Brian.
Let's say welcome, Ed.
Welcome, Ed.
Let's say welcome,
Dr.
Doc.
Ed. Oh, Dr. Ed, as opposed to
Dr.
Mr.
Ed.
Ed.
As opposed to Mr. Ed.
Yeah.
Exactly. I did work with Alan Young. By the way, Ed, Doc, you may appreciate knowing that. I did work with Alan Young for about 3 months back on General Hospital. Very, very nice man. And for me, having grown up watching Mr. Ed, it was a real thrill.
Oh, there you go. So,
thank you. Tie that all in together.
Shall we call you Dr. Ed or Dr. Moser?
That'd be fine.
All right, then.
Ed's good, too.
All right. Now, well, we like to maintain a certain formality because gosh
God
knows the rest of the show goes to hell.
That's true.
He spent enough time educating himself to get the expertise and earn that pedigree.
Absolutely. So, you have some very impressive qualifications. I'm going to guess, though, that as impressive as all those are, and I should mention that he is Dr. Edward Moser is one of the few board-certified veterinary nutritionists, which means he has an extraordinary amount of letters after his name, Brian. Look
yes,
at that.
He does. I know. That's extraordinary is right. Acronym personified.
And he's an expert resource on the natural feeding of pets. So, I believe you're also an adjunct assistant professor of nutrition at the University of Pennsylvania, which sounds wonderful.
Well, it's not
Except
only wonderful,
I don't know what that means.
Well, I'll tell you what. Adjunct professor means that he is attached to, while not officially affiliated. If I'm misrepresenting that, Doc, please tell me. But I must point this out. You do realize that we're talking the highest levels of education from certain perspectives, because the University of Pennsylvania is one of the ancient 8 known as the Ivy League.
I did not know that. You see, I don't know a lot of this stuff, Doc. So, but anyway, you sound terribly impressive. I know you're impressive because we've talked to you before. So let us try and crack on with that subject of what people should or should not feed their pets around this time of year, Thanksgiving, Christmas, etc.
Well, Annie, from a veterinarian's perspective, what most of us like to hear is moderation in all things. And the reason is because, our pets are used to having hopefully a quiet mealtime, a planned mealtime, either some canned food or dry food, complete and balanced, that's going to meet all their needs for the day. Suddenly we determine they're going to participate in a holiday with us where we allow them a protein overload, a fat overload, a salt overload, and a sugar overload if we give them what we're eating from our table.
Now, as
Don't
veterinarians...
forget, dogs also like to drink punch. So all those things can happen to our pets on Thanksgiving.
And I know for us with our veterinary clinics that we have, we know we better have extra staff on the day after Thanksgiving or Christmas for all those pets that are showing signs of pancreatitis. So that being one of the most common and possibly fatal problems that can be associated with incorrect feeding, can you let us know what is pancreatitis and what particularly can cause that within, particularly dogs that we see it in, I think.
Yeah, let me back up and tell you what sort of the owners will see once their dogs overindulge, and you'll be oh so surprised to hear it's vomiting and diarrhea. That's what we see, gastric overload, and it's just what we would expect. What we don't see is what's going on inside the animal, and that's, Annie, what you alluded to with the describing pancreatitis. And pancreatitis is actually just what its name implies. It's an inflammation of the pancreas. You're insulting the pancreas by all these fats and proteins and salts and sugars and things it's not used to. And so what a lot of tissues do when they get insulted is they get inflamed, and then they don't work correctly. And so you get vomiting and diarrhea. If it stopped there, that would be fine, because it would be something that most cases are treated with nothing per os and nothing by mouth, and, they get better on their own. Unfortunately, some dogs who have a severe case of pancreatitis or an inflammation of the pancreas get damage to the tissue itself, get damage to the pancreas, which down the road can lead to other health problems. And one of the most notorious ones is diabetes mellitus.
So I know it's one of the most painful things that we see animals suffer from. And I'm sure, like us, you encourage people to not just dismiss vomiting and diarrhea as, oh, well, he may get better in 3 days, because there's nothing more annoying as a veterinarian to get a call well, he's been like this for 4 days.
Right.
So when should people take their dog in or cat or be concerned about it?
Well, certainly, dogs that have the party day on Thursday often will be sick Friday night or Thursday night, Friday morning, and a lot of them will stop there. What the dogs you get concerned about are the ones that continue to have episodes of vomiting and diarrhea, and especially those that become dehydrated. They need to be seen by a veterinary practitioner.
And so we have about a minute left in this section. I know we're going to be staying with you for the next, so that we can look at another issue that kind of follows on from this. What are some of the people want to make their pets feel special by feeding food? At the same time, I don't know if it's a guilt thing, I'm eating something wonderful, I want them. What are your suggestions to kind of make the person feel better? The dog or cat really doesn't give a hoot, we know that. But for the person, what can you do to make these owners feel better? What can they feed them?
Well, I'm talking today about the wellness line of products, and so I can give you some ideas from the products they make. And if you look at the wellness line of foods, what you'll see is that, and most people want to feed a canned food to make it more like a human experience. What you'll see is that there's a wide variety of choices, and several of them are turkey-based. And so that's a fun thing. One of the, two of the favorites I see on the list are turkey and duck stew with sweet potatoes and cranberries. And that's a canned.
That sounds good. I may not have to cook this Thanksgiving.
And
I might just get some
would like to point out when you said it sounds like a fun thing, Doc, that it probably doesn't sound like so much fun to the turkeys.
Nor the duck.
Indeed. The cranberries are okay with it.
So that's some. I tell you what we're going to do. Let's go to our break, and then we'll come back and finish that particular discussion on what is available out there to make people feel better. Because apparently I said something earlier on in the show that Brian has corrected me on, and I need to explain to him what it means. And I've got you all hanging on. What did I say that means something totally different in America than it does in England? So apologies to you. You may not even picked it up already, Dr. Moser. You are listening to the Annie G. Pet Show. Brian, of course, is here with me, and we are speaking with Dr. Ed Moser, one of the country's leading animal nutritionists. So don't go away, because we're going to be right back.
That it's right. If my dog wants to sleep on the bed with me all night,